So that we have 6 items. These 6 items in introduction we have to cover it. Number 1, greet the patient, introduce yourself, identify the patient, confirm the agenda. If you are speaking to a relative, ask him if he is next of kin or no. Number 6, if we are going to breaking bad news of patient, we have to ask, do you want anyone of your relative to attend this meeting or not? I will give an example now for this introduction. Assume that we have patient has chest pain and already we did for request for him CT pulmonary angio and we found that he has pulmonary embolism. And the patient written in the exam paper, you have to, his son, Mr. Ahmed Ibrahim, he is waiting you to discuss the condition of his father and assume that he has a consent from his father to discuss the condition with you. Let us now to tell the introduction. Good morning, Mr. Ahmed Ibrahim. I am Dr. Ahmed Maher, Senior House Officer in the Emergency Department. Nice to meet you. Nice to meet you, Doctor. Before starting the discussion about your father, I believe that you have a consent from your father to discuss the condition, his condition with me. I'm right? Yes, Doctor, you are right. We are going today to discuss the result of imaging that request for your father. Is that okay for you? Yes, Doctor. Do you want anyone of your family to attend this meeting with us? No, Doctor, go on. This is a simple introduction. Good morning. I am Dr. Ahmed, Senior House Officer of Emergency Department. Greet the patient. I introduce myself. Are you Mr. Ahmed Ibrahim, the son of Mr. Ibrahim? Yes, Doctor. Just identify your patient. Confirm the agenda. Before confirming the agenda, you have to ask him, I believe that you have a consent from your father to discuss the condition with me. That's right? Yes, Doctor. Confirm the agenda. We are going to discuss the result of the imaging has been done for your father. Is that okay? Yes. It is breaking bad news. So that, Doctor, do you want anyone of your family to attend this meeting? This is introduction. يبقى introduction we have 6 items, we have to cover it. If no breaking bad news, خلاص, don't offer for him to any relative to attend the meeting with him. If you discuss the condition with patient, so that no need to tell him do you have a consent or not, because you are discussing with the patient. This is introduction. Task. First, don't allow to the patient by his attitude to distract you about the protocol of communication in this part. Sometimes we face angry patient, and once you start the scenario, the patient shouting and he is angry and he distract you about the pathway. Please don't allow for him to do that. Let the patient to speak and don't interrupt him. You have to listen carefully with non-verbal clue by hitting your head, just making a sound during the patient speak, like that. It is non-verbal clue and is listening for the patient and one of the communication skills. We have some questions to ask the patient about that. Once you finished your discussion, as usual, in your clinic, if the patient come to see the result of investigation, or relative come to you to ask about his father or his mother, what is the first question for him? How do you feel now? This is the first question. How do you feel now? You have to start your communication after introduction for the patient. Mr. Ali, how do you feel now? If you are discussing with the relative, please, could you tell me how is your father now? It is very important to make a rapport with the patient. It is a two-way of discussion, this communication. Let the patient to speak and reply to him in sympathy and empathy manner. If the patient told you, doctor, I still feel pain, I have shortness of breath and lost weight, you have to reply, I am sorry for that. It is sympathy and empathy for the patient. You have to make this way in your discussion with the patient. Don't listen only. You have non-verbal clue and verbal clue. Don't interrupt, but it's just a matter of sympathy. First question, how do you feel now? Second question, how much you know about your illness? It is a very, very important question because the patient will tell him how much he is thinking. Patient has chest pain. When you told him, how do you feel now? He mentioned for you, I have pain. When you asked him how much you know about your illness, he told you that when I came to emergency room, I have this pain. But after that, he make a tracing for my heart, like it is ECG, but we are speaking now on medical term, tracing to my heart. And I feel better. I feel a little bit better. So that first question, how do you feel now? Second one, how much you know about your illness? Third one, do you know why we requested this investigation for you? It is very important to know what is inside the mind of the patient. Last one, what do you expect about the result of investigation? To know also what inside his mind. I expect that, doctor, it is a simple chest pain because I have coughed long time ago and travel abroad, so that maybe some bug could be bug inside the chest. He doesn't aware about pulmonary embolism at all, and the diagnosis was a pulmonary embolism. So now, before start the discussion, we have to ask the patient or relative, how do you feel now? Or how does your father feel now? How much you know about your illness? How much you know about your father's illness? Do you know why we requested this investigation for you? Or do you know why we requested this investigation for your father? What do you expect about this, the result of investigation? This is the 4 questions.